The American Cancer Society predicts 2024 will see more than 106,000 new cases of colon cancer alone. Those diagnoses are split nearly in half when it comes to men and women. While an uncommon topic of conversation, it is important to get screened and try to prevent this disease. March is Colorectal Cancer Awareness Month, and joining us live this morning, Dr. Mariah Wright, a surgeon with St. Francis Medical Partners. Thank you for joining us.
Thank you for having me. How you doing this morning?
I'm well. I'm interested in getting to know more about why you think it's important to share this awareness with people.
Absolutely. So one of the most important things is that colorectal cancer screening guidelines have changed over the last few years, and I find most people still aren't aware of that. Sometime in the last 5 to 7 years or so, the guidelines changed from starting screening at age 50 to starting screening at age 45. The reason behind that change is that we were seeing younger and younger people getting diagnosed with advanced cancers. So we want to start screening earlier so that we can catch those cancers before they become advanced. The other part of this is that the most common symptom of colorectal cancer is no symptoms at all.
Wow. Wait, that's
huge.
I mean, no symptoms. So, okay, can we step back for a second? So,
Sure.
It's lowered to age 45. When there are no symptoms, let's get to more on that. But can you explain some of the lifestyle factors and what it is that's maybe bringing this number down and why it's so important to get those screenings?
So some of the things that have been associated with an increased risk for colorectal cancer are a high-fat diet, low-fiber diet, smoking, alcohol use, eating a lot of red meat. And if you smoke and drink, that increases your risk even further. And the typical American diet is full of high-fat, low-fiber processed foods. And I think that's a lot of what is causing that increase that we're seeing.
Okay, now I really want to focus on this no symptoms part. And if there are no symptoms, okay, we get the screening, but is there anything at all that we can look out for?
So the most common things, if you are noticing a change, would be some blood in your stool, either kind of mixed in or like a stripe on your bowel movement.
A what? A stripe?
Like a little stripe of blood.
Oh,
if you look at
okay.
your poo.
Okay.
Yeah. And then, if you have a change in your bowel habits at all, and what I mean by that is if if your poop used to come out about like this and now it's coming out a lot smaller, that is considered a change. If you are noticing that you're more constipated, it's more difficult to get bowel movements out, or if all of a sudden everything's getting really loose, those are all things that you should seek care for, and that we would start looking at with a colonoscopy.
Okay, what was interesting to me was when you said that younger people are getting this, people in their 20s and 30s. Why is that? Is it that lifestyle that you were talking about?
So we think a lot of it is related to lifestyle. We certainly have been seeing folks that young get cancer all along. A lot of them have some sort of family history that puts them at an even higher risk. But we have been seeing over the last 15 years or so that there are more people who do not have that family history that are being diagnosed with colorectal cancer.
Okay, I know that you don't usually hear the word cure and cancer. What are the treatments and what are the outcomes that we're seeing with this?
Sure. So what we see is that between 80 and 90% of colorectal cancer patients can get back to normal health if we detect it and treat it in its earliest stages. And what I mean by that is before it has spread to your lymph nodes or spread anywhere else in your body. The way that cancer screening and colonoscopy in particular helps with that is we are able to catch those polyps that turn into cancer either very early before anything has a chance to spread or before it even turns into cancer in the first place.
And so is this a surgery? Do they remove part of the colon? Is that how you get it out of the body?
So colonoscopy is a procedure typically done by a gastroenterologist where they take a camera after you've done a bowel prep, basically pooped your entire colon clean. And they look at the entire lining of your colon. And if they see any polyps, they will take those out and they try and remove the entire polyp. If they see something that looks more like a mass, they may just biopsy it instead, rather than try and take the whole thing out and potentially perforate your colon. Depending on what those biopsies show, you then would be referred to somebody like me who would potentially take out part of your colon if that's what's needed in order to remove that area of disease that we're concerned about.
Great information. Thank you so much, Dr. Wright. We've been putting the information to contact you up on the screen, and we just really are thankful for this information today.
Yeah, absolutely.